COVID-19 has exposed the inadequacies in India's health infrastructure. India was taken by surprise in the second wave, and we saw panic in many cities due to the speed of the infection. We also saw the inadequacies of the policy response, lack of adequate research, communication, lack of oxygen, health infrastructure, etc. So it is time for India to relook at the health infrastructure and invest heavily so that in future, we will never have to come to such a pass where people could die for want of a hospital room or for want of oxygen in any part of India. Now, we are seeing the story in urban India, but we have not read the stories in rural India. So here is what I think we ought to do. India only has 0.5 beds per 1,000 population in the public healthcare space and needs to invest heavily. Overall, we are around 1.2 to 1.4 because 60-65% of health infrastructure is private and is expensive, and not everybody can afford it. So what we suggest is India should look at her districts, and in those districts where there is no tertiary hospital, build one. India has 720 districts. India is about 40% urban. Pick up 500 districts and build a 500-bed tertiary hospital, which can be expanded to 1,000 beds in case of an emergency by just having more people equipped with oxygen and equipped with good equipment, not the latest equipment. It can be 1 in 5, and each bed, each hospital could cost something like about, let us say, 500 crores. So if you have 500 crores into 500 hospitals, that is 250,000 crores, and this can be done across India so that we build up in every district of India good health infrastructure. A district has about 20 lakh people, that is 2 million people on an average. And I think the rural districts are much more concentrated. So I think we need that in a very, very big way. We also need to make sure that we build access to these hospitals. And that's why in every district, we should have a 108 ambulance service so that people can be ferried to the hospital in case of need. And that can help decline maternal mortality, infant mortality, etc., and improve access to healthcare. People do not have to die because they couldn't get healthcare. India has Ayushman Bharat, which is promising to give health insurance for many, many diseases, most diseases, in fact, for about 500 million people. That's about 100 million families. So the payment for these hospitals can be taken care of in case we are able to build it. We also need to make sure that we have the human capital for India's needs. India is short of doctors, India is short of nurses, and this is a problem that can be addressed. India has more than 600 medical colleges. We have 88,000 medical seats as per the latest data. We have 54,000 seats for the MD courses, postgraduate courses after you do your bachelor's MBBS and become a doctor. India needs to expand that to maybe 150,000 for very different reasons to make sure that we have enough doctors in the system. For this purpose, our suggestion is that pick up those medical colleges which are more than 20 years old, and I think there are 300 of them, and allow them to expand capacity by up to 50%. Assuming that these 300 medical colleges possibly have about 40,000 seats, you can easily expand it by 20,000 seats. They have the brand, they have the faculty, they have the ability, and they can easily do that. So by doing that, you give increased access to young people to do their medical degree at a very low cost because these colleges already have the brand and the ability. And also rework the norms for student-teacher, student-pupil the data, because I think it's very important that we have global norms. Our norms are too rigid and too old, and that has to be expanded. We have a very, very small ratio for a faculty student in the medical colleges, and that is inhibiting our growth. Also make sure that we allow our students to learn medicine in their own native language. For example, why can't they learn and do their medicine in Hindi? They must learn the English language because English is a global language. The reason is Russia teaches its students medicine in Russian, the Chinese in Chinese, the Japanese in Japanese, the Germans in German, right? Why can't we teach them in their own native language? If we teach them in their own native language, they can communicate to the patients much, much better, and they can be much more friendly. I think that's what needs to be done. And then India has maybe 6,500 talukas. Talukas are one level below a district in every district, And these talukas possibly have about 500,000 people each. We need to build a primary health facility. In each taluka, we need to build at least primary health facilities. And even if we assume that in 70% of them, we need to build, that is in the rural areas, primarily, we need about 16,000 primary health centers. And these health centers can be run by the medical colleges nearby, because medical colleges have students, they have faculty, and every student should learn community medicine. And these are not going to cost more, maybe 1 crore to set it up. And we only need 17,000 crores to increase that. And at that time to medical colleges, it takes care of human capital. And I think there's a very important thing, because primary health has to be the prime force. So these are all the physical infrastructure. On top of that, we need to build a digital layer to enable access to health through the mobile. About 600 million people have a smartphone in this country, and possibly next 2 to 3 years, it could go up to maybe 800, 900 million, because the cost is coming down. There are many apps which can help access digital technologies for patients in remote areas. Telemedicine has been allowed, and you'll be surprised to know that only 35% of the time a super specialist is taken up right now. They have a lot of surplus time, and because of telemedicine, people can get medical advice right and diagnosis right from their homes. And this is helping expand the facility across India. Each of these primary health centers could have telemedicine with the best doctors, etc. We also need to make sure that the people who do their doctor degrees in India stay in India. And if we can expand that seat to 150,000, possibly by 2025, by 2030, we could be producing doctors for the world. Why can't we allow young people to become doctors, get a good education, and be doctors to the entire world? They could go anywhere they want. Why can't we have surplus doctors? So we become the center. For example, in Indian IT, we get 60% of the work that is done in software across the world. Why can't we provide healthcare to the entire world? Cuba has 35,000 doctors all over, and we can do that very, very easily. Now we need to produce nurses too. And for these nurses too, it's important nurses are attached to medical colleges, because nurses help doctors, they have to work together. India has a bad policy where they have independent nursing colleges, which are run like ordinary degree colleges. And many of them are very, very bad. Why can't we allow these 300 medical colleges, which are more than 20 years old, to start a nursing college with 500 seats per year? So they produce 150,000 good nurses every year after 3 years. And I think this is very important, because human capital is a bedrock of good medical care along with digital technologies. Then we need to also make sure that these doctors stay in India as much as possible. They could go out, that's fine. Why do doctors go out after doing the basic degree? They go out to do their MD degree, the postgraduate degree. They want to specialize for whatever reason. That's an aspiration. And India loses a lot of young doctors. We have only 54,000 seats in MD. Why can't we increase it to 100,000? Now you may ask, how can we train 100,000 people in postgraduate? There are many corporate hospitals. All of those corporate hospitals which have a high degree of care as teaching hospitals. So these young people who want to do the postgrad, you can send the internship or their residency in these corporate hospitals working under very good doctors. These are specialists, and their MD is a specialization, and they could work across them, and this is available. We only need change in regulations to do all this. And then what about the health infrastructure at the government level? Now, we have the insurance program. We will have the public health expanding by 250,000 beds in case all this is done in the next maybe 3 to 4 years, which can easily be done. We are building up the human capital. We need a policy response. And for that, COVID has exposed that we need virology labs. We need many research labs all across India. It's a very big country. We have only 1 or 2 virology labs. We required maybe 10 or 15 across all the states. And in most of the states, their health policy makers' infrastructure should be improved by setting up a group of people who are specialists, who can monitor healthcare and who can invest. They have to make policy. COVID has demonstrated that each state has to handle a pandemic on its own, and each state has to build up infrastructure. We also need to build up physical infrastructure for oxygen. And for that, a policy response that all hospital beds above, let us say 100 beds across the country, should have their own oxygen plant or have enough supplies for 1 week. And all hospitals above 100 beds should have a stock of medicine and everything else to take care of emergency for 15 days. So we need to improve the health infrastructure to make sure that all this is put into place. And we also need policy responses. We need research. We need to encourage our pharma companies too. Now, the pharma companies are being encouraged to have APIs made in India and to have many other infrastructure and the PLI scheme. But we must not beat down on prices because they need to generate the surpluses to reinvest again. R&D is very expensive. And the only way R&D can be done in these pharma companies is by having proper prices. Yes, India is the generic capital of the world, but we don't do our own APIs. Maybe 90% of APIs are imported from China. And this does not help when there's a crisis because the market could be shut to us. So India has this program, and we must have blue sky research being done. Maybe the federal government or the central government should have a 5,000 crore budget every year. And they can do that in many innovative ways to fund biotechnology and to fund research. They already have a fabulous, startup policy in Bangalore, in BIRAC in Bangalore. They're doing a lot of work, but that has to be improved by a lot more public expenditure. And I think if you're able to build this kind of a physical infrastructure, develop human capital, create a network of primary health centers, hospitals, human capital through nurses and doctors, create a policy response, create an ambulance service, and top of that, have a holistic system of medical insurance for everybody. And the government should do it in the public sector. I'm not against the private sector, but not everybody can afford to go to a private hospital. It's expensive. And private hospital is expensive because the costs are high. In the public area, people often say private hospital too expensive, but the public hospital don't cost everything. They almost have similar costs, maybe 20% less. What we need to do is to increase health spending in a partnership between the central government and the state governments. We could also invite many of these big charities or philanthropies to invest. We have people like the Azim Premji Foundation, the Reliance Foundation, the Infosys Foundation, Bharti Foundation. Ask them to adopt, and the Tatas, ask them to adopt 100 districts and set up a 500-bed tertiary hospital, and then have a partnership with the medical college to run. Now, these are all problems that are solvable. What requires is a policy response. What is required is a drive from the government. What is required is the focus. And every state in India should make sure that it has reasonable health infrastructure in this country. It is no longer acceptable that anybody dies in India, in free India, after 75 years of freedom, which is going to happen next year because of want of medical care, want of access to medical care, or want of money to buy medicine. Medicine has been tackled by the government by having their own stores at low prices. So many things have been done, but we need a holistic program to make sure India has a top-class medical health infrastructure. Health which takes care of preventive health, which takes care of well-being, which takes care of treatment, which takes care of insurance and payments, and assures every Indian they have equal access to healthcare. Thank you very much.